Hello, so I just wanted to jump on here as an aspiring African-American male physician who recently lost a friend, Adam, to a cancer that metastasized, spread from his lung tissue to his brain. To really re-emphasize or let people know the importance of cancer screenings and blood panels, especially if you have access to, say, insurance plans that will cover these. I specifically want to address the African-American population, specifically the male population, because I do frequently hear the distrust of the current healthcare system, which is totally understandable, especially if you are aware of the history, including, say, the Tuskegee experiments. So I do understand it and I feel for you, but that doesn't mean that, for me at least, that does not justify our tendency to not utilize the resources that we have at hand. Which, to utilize them, I will say you often have to advocate for yourself as well as each other, which is why I am here. And for most common people, there is a stigma associated with cancer screenings because we know that cancer screenings require x-rays, right? And we know that x-rays are often perceived as harmful because, yes, they can contribute to cancer. However, I would argue that whatever sieverts of radiation that we are exposed to, say, getting an x-ray scan, is trivial in comparison to, say, the presence of an uncovered proliferating tumor. So there's that. Briefly, though, I do want to emphasize the presence of underlying mental heuristics, so these shortcuts that we use, whether conscious or unconscious, to facilitate our decision-making processes. So we have certain biases, okay, like the hindsight bias or the representativeness heuristic, my apologies, that we are predisposed to actually favor information such as, say, the Tuskegee experiments that happened in the past, and those overshadow our current perceptions of the present. So what that means is that we are naturally less inclined to advocate for ourselves, to put ourselves into uncomfortable situations, such as stepping into a healthcare facility to request a blood draw, a blood panel, cancer screenings, because we know of the past, which, because it was negative, overshadows our perceptions of the present as well as the future. Likewise, whether conscious or unconscious, if we maintain the belief that African Americans are generally mistreated in healthcare settings, we are less inclined to, once again, seek care. This is problematic because we know that certain ailments, certain maladies, certain cancers manifest like that. So it is most optimal for us to, yes, recognize that these problems and these perceptions exist, but likewise we need to build from them to ensure optimal care for ourselves and our family and our community. And we also know from racial concordance studies that patient outcomes are often the best when we have a provider that looks similar to us, so that we identify with in some way. Okay, so if it helps, I recommend that we all go out and search for a provider that we can identify with, as this shared identity builds connectedness, and this interconnectedness is vital for establishing, say, patient-provider rapport, which is conducive to the best patient outcome. So yes, that's all I wanted to hop on here and share. Overall, my message is just to continue taking care of your guys' self, because we know that these are some pretty bleak times that we live in. So yes, keep caring for yourself, guys.